Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care and Fiscal and Administrative Services Division. This webinar is being held on March 19, 2021, and is scheduled to run from 10 a.m. until 11 a.m. We'd like to thank you for joining us, taking some time. My name is Stephen Profiter, and I'm the director of the Early Learning and Care Division at the California Department of Education. I wanted to open this morning's webinar to address the latest violence, which occurred earlier this week. I think it was just yesterday in Atlanta, that it appears to be racially motivated. Also, during this pandemic, we've heard too often misinformation and racist rhetoric relating to Asian Americans and the COVID-19 pandemic. This behavior and the violence targeted against Asian women is disgusting, and we condemn it. I'll turn us back to the webinar and cover some brief updates here. I am happy to share this morning that we have a couple of guests with us today. I'm excited to welcome to today's webinar Shauna Wynn-Swan, who is the Assistant Program Administrator, and Melanie Hewitt, a Policy Analyst from the Child Care Licensing Program at the Community Care Licensing Division within the Department of Social Services. Shauna and Melanie, thank you so much for joining us today. Before I hand over to Erica, I just want to note that it feels, we've said this on a couple of other webinars, that we're seeing light at the end of the tunnel with the rollout of more vaccinations becoming available. I'd also like to note that yesterday, the State Superintendent of Public Instruction, Tony Thurmond, announced a partnership to roll out 3 million rapid tests to support schools as they continue to reopen safely and quickly. We want to thank you again for all you're doing for families and children. We take time out each webinar to thank you, and it's not enough to say thank you, but just know that we're doing our best to support you as you support children and families. And I'll turn it over to Erica now.
Thank you so much, Steve. Erica Otiono again, Associate Director. We are really glad that you have joined us for this webinar. I just want to echo what Stephen just said, but wanted to add that I want to let you know that we have seen the many pictures, videos, text of the wonderful and innovative activities you have sent to your consultants during for the remote monitoring reviews. For all those, we cannot stop telling you, we can't stop telling you how appreciative we are of all that work that you continue to do. In a few minutes, one of the PQI consultants, Megan Jones, will provide update on the just released management bulletin on program self-evaluation. We'll have a subsequent training specifically on the program self-evaluation that will be on April 14th. They will focus just on this modified program self-evaluation. Really looking forward. Thank you, Megan. Thank you, everyone. Enjoy this session. I'm now going to hand it over to Virginia.
Good morning, everyone. Virginia Early, the Administrator of the Policy Office in the Early Learning and Care Division at CDE. Thank you so much again from all of us here in ELCD. I won't go into too much about what we do, all things policy. You'll hear more from me later. Just know that as we go through our policy guidance process and then collaborating on policy development, we so appreciate the opportunity to hear from all of you about the needs of the field so that we can elevate and address those in the work that we do. So now I'm going to turn it over to Shauna from the Department of Social Services.
Good morning. Good morning. Hello, everyone. As Stephen mentioned, I am the Assistant Program Administrator. My name is Shauna Wynn Swan, and I'm the Assistant Program Administrator for the Child Care Licensing Program Office and Community Care Licensing at Department of Social Services. I oversee Region 1, which is the Child Care Licensing Program headquarters, and then also portions of Northern California. Thank you so much for having us join today. It is our pleasure to share with you the state's current vaccination efforts for the childcare sector, and then also some hot topics about COVID guidance and cohorts. Again, I'd like to echo what my partners have said. Thank you so much for your dedication to California's children and families. It's because of you that children and families are thriving. And with that, I would like to also turn it over to my colleague, Melanie, who will be co-presenting as well.
Good morning. Thank you for having us here. We look forward to sharing some important information with you about the cohorts and vaccines. And I'm going to send it back to Virginia right now.
All right, thanks. And this is really special that we're able to be here with our partners at the Department of Social Service Community Care Licensing. So thank you, both of you. I will now hand it over to Alana Andrade, who is our moderator.
Good morning, everyone. And I'm Alana Andrade, and I'm a consultant in the policy office here at the Early Learning and Care Division. As I moderate your webinar today, we've got a great team as usual and helping to make this presentation run smoothly. From the policy office, we have Danielle Davis, Eric Dunk, and Barbara Lindsay. From the PQI office, we have Megan Jones, Mignon Pollard, Deborah Rawson, Lupe Lopez, Cassandra Lewis, Brittany Sheffield, Year Zong, Richard Miller, Serene Yi, Christina Toney, and Katina Boulay. And from the Child Development, Nutrition, and Fiscal Services, CDNFS, we have Andrea Johnson, Corey Kahn, and Alan Lynch. And from the Child Development Management Information System, CDMIS, we have Carly Nodahara. And here to answer any questions regarding nutrition or food programs, we have Shashi Sharma. And of course, we have Shauna Wayne Swan and Melanie Hewitt to assist with any questions specific to CDSS. Once again, our team is committed to being as responsible as possible. And just to reiterate, our team won't be able to answer every question, but we do appreciate being able to engage with you in such a quick way. Also, our chat box is disabled. We will be able to share links with you there, but you will be unable to chat with us. So please utilize the Q&A feature to ask us any questions. And back over to Stephen to review the agenda.
Thank you, Alana. So as you can see from our agenda, and as we normally do, we have many things to cover. Since our last webinar, things continue to happen, not just at CDE, but across the state. And as you know, things are fluid. They remain fluid, and we're doing our best to keep up with those changes. For today, the policy office will be providing some updates on some upcoming guidance, as well as the information, what we have, what we know from the American Rescue Plan Act that the president signed last week. Our fiscal team will be on to discuss the status of CARISA funds, some stipend allocations, and alternative payment contract amendments. As Erica mentioned, we've got some updates from PQI on the program self-evaluation, very exciting. And then finally, I feel like I'm bubbling with excitement that CDSS will, and I won't preview too much, but the CDSS team will present the overview of the vaccination provider information notice along with cohort guidance. After we've gotten through our agenda, we'll review some questions that have come in from all of you. We're going to do our best as we do each week or every other week to address as many questions as we can. Please use the Q&A function as Alana mentioned. And for anything that we don't get to, as always, we will continue to address through FAQs on our website. And now back to Virginia.
Awesome. So diving right in on upcoming guidance. So we talked to you about how as a result of Assembly Bill 82, there are 3 different management bulletins that we're working on. Those names of the management bulletins are listed on the slide. They're currently sort of most of the way through our development and review process. So we're hoping that we'll be able to release them in the next week or so to the field. So just as a quick reminder, we have a management bulletin that will related to the extension of emergency childcare services and new enrollments in emergency childcare services for essential workers and at-risk populations. So this updated guidance will sort of speak to the 76 million that will be allocated for extension of emergency childcare services for families currently enrolled, and also the 80 million that's available for new enrollments into emergency childcare. So just as a quick reminder, families that are sort of newly enrolled in emergency childcare will have to meet income eligibility, which is different from previous enrollments into emergency childcare. However, they can self-certify their income and need for services. The second one is a reimbursement and data collection requirements for alternative payment programs and providers and non-operational days for closures related to COVID-19. So this one will be sort of speaking to the additional 16 non-operational days that voucher providers, so CalWORK Stage 2, CalWORK Stage 3, CAP, and CMAP will be getting for COVID-related closure days. And then the last one, just as a reminder, is the reopening and reimbursement requirements for direct service contractors and specific to the non-operational days for closures related to COVID-19. So this one will be rescinding and replacing Management Bulletin 2018, and to add in pieces around how family childcare home education networks, now their providers, in addition to the hold harmless provisions in Management Bulletin 2018, will also be receiving 30 new paid non-operational days for closures due to COVID, but not covered by the pieces already in Management Bulletin 2018. So the first bullet will be rescinding and replacing 2014. The second bullet will be a new Management Bulletin. And then the third one will be rescinding and replacing 2018. So moving on to the next slide. As Steve said, on March 11th, President Biden signed the American Rescue Plan Act, or ARPA, or ARPA. I think everyone's still figuring out how to say the acronym. But the Center for Law and Social Policy, which is a national organization that does policy analysis and other supports, has estimated that of the total amount appropriated, California will receive $3.8 billion in federal child care and development fund. So that's a lot of new money for our system. So we wanted to alert you to this. The funds are not in California yet, but we want you to be aware that they are will be coming to California. We don't know exactly when. I think the last round of funds took about a month from the federal, to sort of reach California from the time the federal government had signed it. Sometimes a little bit more. It depends on various aspects. So we'll be updating you as these funds, as more information is coming about them. But just a couple key updates. Across the country, there's a significant amount of money as well, and these funds have to be obligated by the end of September 2023, and then states have until they have to be liquidated by September 2024. So there are a couple allowable uses of the funds. But generally, the funds can be used to help low-income families afford childcare, provide childcare assistance to essential workers regardless of income, help providers reopen and cover past pandemic-related expenses, and also pay operating costs. So I just want to emphasize that any new federal funds have to be appropriated by the legislature, and the statute will say how the legislature is planning on allocating the funds, and then the departments of the state will be administering them based on state law. And so I think this is obviously a sizable amount of funds. So if you have ideas for ways that the legislature and the governor should consider allocating and appropriating the funds and for what purposes, we recommend you get in touch with your elected officials and come give public comment at budget and policy hearings and so forth, so that your voice is heard. So I think with that one, let's go on to the next slide, which is Alan giving us an update on the current round of federal funds that have arrived in California, that have been appropriated by, a portion of which have been appropriated by the legislature, and now we're working on implementing. So I'll turn it over to you, Alan.
Well, thank you, Virginia. Good morning, everyone. My name is Alan Lynch, and I am a manager in the Child Development and Nutrition Fiscal Services Unit. And today I'm going to go ahead and provide just a few fiscal updates. For our first fiscal update, I want to provide some information related to the status of funding from the Coronavirus Response and Relief Supplemental Appropriations, or CRRSA, Act of 2021. In early February 2021, California was awarded $964 million in Supplemental Federal Child Care and Development Fund, CCDF, program funding from the CRRSA Act of 2021. As Virginia was just explaining the state process, Assembly Bill, or AB 82, then appropriated $402 million of the CRRSA funds in fiscal year 2021 for the following purposes. There was the extension of emergency child care, the new emergency child care enrollment, and then also the $525 flat rate one-time stipend for subsidized children. While the CDE has completed the allocations associated with this funding, it is important to note that the State Controller's Office, or SCO, has not yet made these funds available to CDE. I'll go into a little more detail of our anticipated timelines on the following slides, but we just want to make sure that the field is aware that we do not yet have access to these funds. So let's go ahead and go on to the next update. Okay, so for the next fiscal update is in regards to the upcoming amendments to the alternative payments, or CAP contracts. Amendments need to be made to the CAP contracts for a number of term purposes, but to prevent delays in processing, these changes are all being combined into a single amendment that contracts should expect to arrive in early to mid-April. In the following list, we've also indicated in the bullets the fund source for each of these allocations. So the first two augmentations are funded by CRRSA funds, which we just discussed in the last slide. And that would be the $76 million for the emergency child care extension, as well as the $80 million for new slots for emergency child care. For this next bullet, we are pleased to announce that we were able to execute our interagency agreement with DHCS this week. And we have now invoiced DHCS for the $21.486 million in Prop 64 funds. Knowing that these funds will be available to CDE very soon, we have decided to incorporate these expansion funds into the forthcoming amendment. However, if there are any delays for any reason, we may choose to separate this amendment out. But as of right now, the plan is to include the $21.486 million for new slots in this upcoming combined amendment. The next two items are actually from our CARES funding allocation. So this combined cap amendment will also include any funding for the non-operational reimbursements, as well as any augmentations for paying at the maximum certified hours of care. Finally, we will also be including in this combined amendment any extensions to the period of performance for all CAP contracts. So all of these purposes will be combined into a single amendment. Your agency might not have all of them, but they will all be in a single amendment unless there is any delay in the funding. So moving to the next slide. So for our final update, I want to provide some information on the CRRSA stipend allocation. As you may remember from our last webinar, AB 82 allocated $244 million in CRRSA funds to provide a flat rate, one-time stipend amount of $525 per child enrolled in a state subsidized childcare or preschool program. I do want to clarify that this CRRSA stipend is in addition to the CARES funding stipends that went out in December 2020 to alternative payment program providers. As previously mentioned, CDE is awaiting access to the CRRSA funds. We are hopeful that checks will be in the hands of contractors in April. These allocations were based on the number of subsidized children enrolled in November 2020. Just as a reminder, for CalWORK Stage 2, CalWORK Stage 3, Alternative Payment Program, and Migrant Alternative Payment, the CDE used caseload data that was submitted via the CalWORKs Alternative Payment online reporting system, while for the General Child Care and Development, Severely Disabled Program, Migrant Child Care and Development Program, California State Preschool Program, and the Family Child Care Home Education Networks, the CDE used data reported in the November 2020 Child Development Management Information System, or CDMIS, CDD 801A report. Additionally, to support the administration of these stipends, CDE contractors are allowed a 5% administrative fee to address costs associated with distributing stipends to providers. The 5% administrative fee was allocated to contractors in addition to or on top of the allocation for the provider stipend. Therefore, this administration fee does not impact the $525 per child stipend amount that providers will receive. Go to my last slide. So we are working to release guidance on the new CRRSA stipends, as we have been receiving many questions on the allowable usage of these funds. While we continue to work on that guidance, we'll share that allowable usages are broad. We've included a list on this slide to give a sense of what allowable costs can include, which are hazardous pay for employees if contractors follow the relative federal regulations. We did release an email to subscribers on the distribution list on February 16th to provide information on issuing hazardous pay for employees. Additionally, this would also be covered mental health services, salaries and benefits, equipment and supplies, and then generally any allowable expense that would be reimbursable under the agency's existing child development contract to address COVID-19 costs or to ensure that the programs are able to remain open or to reopen. In addition to the allowable uses for these funds, we will include in the guidance a time frame for when contractors must pay child care providers with the children enrolled in alternative payment programs or providing care in a family child care home network. We will also include the time frame for when the funds should be spent. As a reminder to local education agencies, LEAs, including charter schools, these funds will be provided to the county treasurer's office and then transferred to the LEA. So the LEAs should make sure they are in communication with the county treasurer's office to ensure a timely transfer of the funds to the individual contractor. And that is it for our fiscal update. Next, we will move over to Megan for the PQI update.
Hi there. Before you speak, Megan, and I'm sorry to break the flow, Alan, can you just quickly go over that about the stipends, if they are for children or for providers? We just want to make that clear as we've gotten a few questions into our chat already.
Yeah, so the stipends are for the providers or the other contractors, depending on the contract type. but they are paid out on a per child basis. So it was the November 2020 enrollment data was used to determine the actual stipend amount that would be going to each contractor or the providers.
Perfect, thank you. Okay, Megan.
Thanks, Alana. Good morning, everyone. For the program quality implementation update today, I'm going to discuss the fiscal year 2020-21 program self-evaluation, or PSE. Breaking news, the PSE management bulletin was just posted this morning. So I'm going to ask that Brittany please drop the link to the MB in the chat. And if you are signed up to receive communications from ELCD through the email distribution list, you will also get an email with the link shortly. The PSE MB describes changes for this fiscal year, provides instructions on completion of the PSE, states what is required to be submitted to CDE, and includes information regarding the flexibility around the use of the Environment Rating Scale, or ERS, tools. For this year, the PSE will be submitted to CDE in the form of a multiple choice survey. I'll speak briefly about the survey on the next slide. Training will be provided on completing the PSE. We have a tentative date of Wednesday, April 14th at 10 a.m. At the training, we will review all the required elements of the PSE and how to complete the survey. The due date for the PSE is Tuesday, June 1st, 2021. Next slide, please. The program self-evaluation webpage also just went live this morning, and I'm going to ask that Brittany drop the link to that in the chat as well. The webpage will contain all the documents included as a part of the PSE process. As you navigate through the webpage, you will find links to the PSE management bulletin, a link to the multiple choice survey, and this year the survey consists of 9 questions. Questions 1 through 8 are multiple choice, and there will be several options to select within each question. Programs will have the opportunity to select all that apply. Each question will contain a space for additional information to be added if applicable. The last question is open-ended and will be optional. We wanted to include a space for programs to share any additional information the multiple choice questions did not capture. Also located on the PSE webpage will be a list of the multiple choice questions. This is a Word document that can be reviewed prior to completing the survey that contains all the questions and multiple choice options. This is for planning purposes only. You will submit all responses through the survey. Some of the supplemental documents that will be on the webpage are the Environment Rating Scale self-certification during a pandemic, frequently asked questions, and links to all the summary of findings documents. Take a look at the webpage and all the contents. Bring your questions to the PSE training and we will review all of this in depth together. Now over to Mignon for an update on the Federal Disaster Relief Grant.
Good morning, my name is Mignon Pollard and I'm a program consultant in early childhood. The Federal Disaster Relief Grant Fund is a part of June 2019 Public Law 11620 authorized a one-time funding of the Supplemental Disaster Relief Act. This grant's purpose is to assist local communities with continuing child care services during and after qualifying disasters. Funding is intended to aid in the recovery of the supply of child care services. And in California, this relief is focused on wildfires that occurred throughout the state. A list of 2018 FEMA declared disaster areas are listed in the application. We received a total of $2,596,560 for this effort. Licensed and non-licensed providers can apply for these grants with a minimum of $1,000 to a maximum of $25,000. There are 5 categories for reimbursement: repair, materials, supplies, equipment, and furnishings. This grant does not pay for any cost that FEMA has already paid for or your insurance policies. And additionally, this grant does not pay for any COVID-related expenses. For more detailed information, please see the link that is there, or just type into your browser when you're on the education website, just type into your browser RFA 2018 Disaster Relief Grant. Thank you, that's it. And next over to CBSS.
Excuse me, thank you. And the California Department of Social Services, in collaboration with the California Department of Public Health, has been working diligently with a variety of federal, state, and local partners, which includes also our local public health departments, community-based organizations, and other public or private immunizers to facilitate an equitable distribution of COVID-19 vaccines. So as you all may know, the childcare sector is currently eligible and is being prioritized for vaccination under Phase 1B. We recently released PIN 2106 that outlines frequently asked questions about the vaccine information. And I just want to emphasize it's really important to note that there's several pathways to receiving this vaccination, and that you do not need to receive or wait for a code. In PIN 2106, it goes into great detail about how the childcare sector may obtain the COVID-19 vaccine. It also contains frequently asked questions regarding vaccinations, such as it discusses the benefits of vaccines. So you can use that information with your staff to encourage vaccination. It discusses in detail who's eligible, how to obtain a vaccination, what verification is needed, and how to schedule. And then even like demographic questions regarding my turn. What is the role of an administrator, a director, a licensee? So there's several different pathways, as many of you know. We definitely have been messaging, go to My Turn to schedule appointments and to receive notifications. But then also there's several pharmacies across the state who are set up as retail pharmacies to help distribute vaccines. And then many of those are CVS, Rite Aid, Walgreens. Those are some of the common ones, and then Safeway as well. And then just keep in mind, depending on your location and where your county, where your program resides, there may be vaccination clinics in the community, different options and offerings. So access can vary depending on location, as the state is ramping up the availability each day to increase access across the board. And there is an equity focus to really reach the underserved communities. We recently developed a resource toolkit that outlines the availability of vaccine clinics. It's located, it's like a one-pager toolkit that has a plethora of resources that outline where childcare staff and workers can access the vaccine. And again, it's what I had mentioned through your healthcare providers, public health chains, local health departments, pharmacy, clinics, and things of that nature. And just to support the vaccination access priority for all, the state launched additional equity efforts specifically for our childcare sector by working with our non-state partners to distribute vaccine accessibility codes. So you may have heard that there was 10% set aside for education and childcare workers. And so that's where that accessibility code that I said, you don't need to wait for that because there's several different options that you can access now. And those codes are being equitably distributed by our partner agencies. And we use the California Healthy Places Index to ensure that codes were being deployed to the most impacted by the pandemic. And then also, again, our underserved, underreached populations. The non-state partners who will distribute those codes based on the Healthy Places Index. There's two of them. It's our California Child Care Resource and Referral Local Offices. They're assisting in distribution, and then also the Child Care Provider United Union, which is a home-based child care provider organization. The vaccine codes are being distributed on a weekly basis. And we can also add links to the chat box if we have not already. Again, and just to emphasize that the child care vaccine code, it's just one avenue for access. There's plenty of other ways to access the vaccine. However, I want to note that if you're contacted by one of the partner agencies to receive a vaccine accessibility code, please let your agency know if you're experiencing any kind of difficulty scheduling a clinic appointment on my turn using that code. If there's any accessibility issues, I just want to say that we're working really hard, the state's working really hard to make my turn more effective, and it's improving each day. So that will allow for increased clinic availability and then also appointment scheduling. If you have any specific questions regarding health and safety, please don't hesitate to reach out to either your licensed program analyst, your regional office, or you can always respond to our, you can submit an inquiry to the CCLD licensing COVID-19 inbox. All right, and I think at this time, I'm going to turn it over to Melanie, and she can discuss the highly anticipated cohort guidance. Thank you.
Thank you, Shauna. I'm really excited to share the updated guidance for cohorts. Child care licensing has updated the information regarding the cohort guidance so that it aligns with the updated school reopening guidance. A new provider information notice is going to be posted very soon with the updated information. Basically, what we are going to be aligning is that licensed and licensed exempt child care providers that are located in counties identified as being in the widespread or the purple risk area must continue to follow the small guidance, small cohort and groups of children and youth that's issued by the California Department of Public Health. For all other tiers, yellow, orange, red, we are asking that you follow the industry guidance for COVID-19 in childcare for group size. And in addition, to visit your county status for information. Basically, counties that are in red, orange, and yellow should continue to have small groups because that reduces the risk of spreading disease. And as cohorts increase in size, or if they have contact with other cohorts, that risk of spreading disease increases. So we ask that you continue to utilize small groups, but you will not be held to that 16 cohort. Your small groups should continue to be 6 feet apart from each other for the extent possible. And also remember, if your local ordinance requires that you have to care within small groups, you have to follow the stricter local requirements. Your local health department may have this guidance for a specific maximum group size, so be sure to check in with your county local public health. Cohort guidance does not permit licensed and license exempt providers to care for more children than authorized by the applicable statutes and regulations or the terms and conditions of the waivers that may be issued to you by our department. All staff to child ratios and group size limitations must be maintained according to the type of license and hold. We look forward to having this pin out very shortly, and please go to the childcare licensing webpage, and you can sign up for pins to be emailed to you directly. And any information that we have about COVID, we've been posting on our COVID resource page, including frequently asked questions for providers and childcare providers and family childcare providers. And I'm going to turn it back over to Alana now. Thank you very much.
Thank you, Melanie. Thank you, Shauna. We so appreciate you having your expertise here. I know definitely folks in the field have been very excited that you are here to answer their questions. So there are a few questions that we've seen, and let's see, who shall I call on first on our unanswered questions? So there are a few questions regarding the stipends, and so I'm going to ask that Alan come back. So there is some confusion regarding fetch-in programs. So one of them, so the stipend is given to a contractor, but then it's distributed to an individual provider for how many children that they have. So, and if you could walk us through a bit about if you operate a fetch-in on a CCTR or a CSPP, are the stipends given directly to the providers, or how would that work?
Yeah, I can answer that. This will also be in the forthcoming guidance as well. But the funds are going directly to the contractors. So if you are you do operate a fetch-in in a CSPP, CCTR, or CMIG, the allocations are going to the contractor, but then they are going to be instructed to provide the $525 per child stipend to those providers for each child that was enrolled in that program in November 2020.
Okay, thank you. And then in close to that question, there was a question about how does the CSPP qualify for the stipend?
Yeah, so the stipends for the contractors that have children enrolled in receiving care in the child care or preschool center or not in a fetch-in, they will retain the full stipend allocation to support the program with COVID-19 pandemic relief. So they qualified by having enrollments that they submitted for a CSPP in that CDD 801A reports for November 2020.
Excellent, thank you, Alan. I'd like to call on Virginia to come back. There were a lot of questions regarding about hold harmless and if that would be happening in our next fiscal year.
Hi, everybody. Thanks. So we completely understand that hold harmless is a topic that's very near and dear to everyone because you want to know what's happening after June 30th. Unfortunately, this is not something that CDE has the ability or the power to do. This is something where the law would need to be changed. So in case any of you out there are policy wonks and want to know the exact code section for the direct service programs that would need to be amended, it's Education Code Section 8209 F. So if that's helpful to you in any way. We continue to raise this in every single conversation we have with legislative staff. We've brought it up in almost, I think, all of the hearings. But your voices are also really a helpful piece of that conversation too, just knowing that there will need to be a legislative change in order to extend the hold harmless.
Excellent, thank you, Virginia. So I'd like to ask Alan back, or perhaps Andrea. So there have been a lot of questions about when the stipends need to be allocated. Is it by June 30th, or will it roll over to the next fiscal year?
Yeah, so I know that is going to be included in the upcoming stipend guidance. We are hoping to get that out and are working to get it out sometime next week. So that information will be included at that point in time once we've gone through all of the approvals.
Excellent, thank you. So there have been a lot of questions about how to define a small group. So I'd like to ask either Shauna or Melanie to unmute themselves. So how would you define a small group?
Hey, Melanie, would you like to address that?
Yeah. Well, a small group is a small group. There is no number attached to a small group. So you can use your best judgment to come up with your definition of a small group within your facility, maintaining your staff and child ratios and your group size requirements for the children that you're serving.
Hi, and I also might add that it's really important to also monitor your county ordinances, as Melanie had mentioned earlier, because your county may have a definition of what a small group is. And so it would be whatever is more strict.
Thank you. And I apologize if you hear the preschool outside my window as I'm trying to speak. So there's a few folks in the chat who have mentioned that the website doesn't seem to be as loading. And something on the CDP website. So perhaps Brittany can just confirm that the website that we had put in the chat is the correct one. Or perhaps it could just be on CDPH's side where it hadn't been updated yet. There has also been some questions about the for the PSE. So I'm going to ask Megan to come back to speak about the SACR, so the environment self-certification during the pandemic. How does that relate to the PSE? Is that still, are we still sending out the survey? Or do we do the self-cert instead? If you could speak a bit to that, please.
Sure, Alana. So the ERS self-certification would be in part with the PSE. It will not be submitted to CDE. The only thing that you will submit to CDE as a part of the program self-evaluation will be the survey. The self-certification is required to be completed if you are open and providing in-person services, and if you are not going to complete a full ERS assessment, you are able to use that self-certification.
Perfect. So we have another question for Melanie. So they just wanted to confirm that the 6 feet apart between children, is that still in effect?
There is a requirement for the spaces in your classroom to have 35 square feet per child. If you look at it from a math point of view, then there is 6 feet around each child if you are licensed facility with that 35 square feet per your classroom. We are not requiring the 6 feet between children. What we are looking at is the guidance that came out from the CDC that recommends that you keep 6 feet between cohorts.
Okay.
So hopefully that helps a little bit.
Perfect. And Melanie, while you're here, could you re-discuss the max amount of 16 in a classroom? I think folks are just wanting to be reassured that is what they heard, if it was 16 still or not 16.
It's 16 per cohort, not necessarily per classroom. Some counties allow that you can have more than one cohort in your classroom. You need to double check what your county local public health is requiring. 16 individuals can be as many children and adults in that cohort that comfortably works for your program. And the other thing to consider is if you are having multiple cohorts in your classrooms, that you may have to follow information about having physical barriers between the cohorts. So again, really make sure that you're looking at what your county requirements are, as well as what the industry guidance is for childcare.
Thank you, Melanie. So there's also some more questions about the program survey. So I'd like to ask Megan to come back. So one question, Megan, is the PSC multiple choice survey only required for in-person, or will it also be required for distance learning as well?
Each program is required to submit one survey per program. So per contractor, one survey. So regardless if you're in person, hybrid, or doing distance learning services, you will be required to submit one survey to CDE. The questions on the survey will capture the variety of services that programs have provided this year.
Thank you, Megan. So I have another question for Melanie. So Melanie, is there current guidance regarding outdoor activities in relation to the cohort guidance in relation to ratios?
The cohort guidance is for indoors. When children are outdoors, you want to make sure that your groups aren't mixing. There is not a cohort guidance that we are, that states it has to be done outdoors as well, but you want to make sure that your children that are in your small groups remain together and don't interact with your other small groups as to the greatest extent possible. So that would apply to outdoors as well.
I also would like to say we do what Melanie has provided guidance on regarding the cohort, that PIN will be published quite soon. And also the childcare industry guidance on the COVID-19 childcare industry guidance, that guidance from July of last year, that's in the process of being updated as well to provide new guidance.
Thank you so much. There's also some questions regarding the PSC email address. And so I'm currently sending a message to folks just to confirm that the one that was presented and shared is the correct one. Let's see. I know that we're running short on time and we do appreciate everyone's time and we want to make sure that we utilize it in a great way. Let's see. Virginia, can you just confirm that the hold harmless current is still in effect until June 30th, 2021?
Yes.
2020.
Yes. Currently in effect through June 30th, 2021.
Perfect. Okay, so there was a question about hazard pay, and so I'm going to ask that Alan come back. So this person was asking for information about the hazard pay and how it intersects with the early learning and care programs on LEA campuses. They thought that they could still provide them for their CSPP staff. Was that correct?
Let me find that question and see if I can send them a response. I'm not sure I understand what question is being asked. I know there was a listserv that went out in mid-February, on February 16th, related to providing hazardous pay for employees. And so which staff are they attempting to actually pay with the hazard pay here?
Well, it said, I wanted to clarify the hazard pay with my LEA supervisor. I was told it would have to be across the board for PK through 8, and I thought this was something I could provide for my CSPP staff. So perhaps that's something a little bit more, sorry, go ahead.
There might need to be more conversation there, but in general, the guidance does state that if you are going to be providing hazardous pay for employees, that staff who have the same or similar job duties across the board should all receive hazard pay based on the agreements, the written agreements that that the agency has in place, regardless of the funding source. So if the CSCP staff do have the same or similar job duties to others and are part of that agreement, then I mean, they would be eligible, at least if they are actual staff and not providers.
Okay, thank you very much. So while our team is still responding to your questions on the Q&A feature, I'm going to ask that Barbara move us ahead to the resource slide. So to find the webinar slides, any management bulletin, frequently asked questions, please go to our ELCD COVID-19 guidance webpage at https://www.cde.ca.gov/sp/re/ELCD COVID-19.asp. To contact us via our ELCD emergency email inbox. That inbox is elcdemergency@cde.ca.gov. To find a list of the PQI office regional consultant, please visit https://www.cde.ca.gov/sp/ci/assignments.asp. Or you can also reach us by phone at 916-322-6233. You'll be contacted to the consultant of the day. And it is good to note that most consultants are most easily reached by email. And to share what our colleagues at CDSS spoke about today, the Child Care Licensing Program website at COVID-19 research page can be found at https://www.cdss.ca.gov/child-care-licensing/child-care-resources. Also, you can reach them at the Health and Safety COVID-19 inbox at CCL COVID-19 info. That's CCL COVID-19 info at dss.ca.gov. I'd like to invite back Erica and Steve to close this out.
Thank you so much, everyone. On behalf of all staff, CDE, CDSS, I want to thank you again for participating. Let's continue to take care of ourselves and others around us. Thank you again. Stay safe. Now over to you, Steve.
Thank you, Erica. I want to again express my appreciation to the team putting this webinar together and share appreciation to Shauna and Melanie for joining us this morning to share some incredibly important updates and answer many of your questions. On behalf of all of us, thank you for taking time out of your day to listen to this morning's webinar, and we hope you'll join us for our next webinar, which is scheduled for April 2nd, 2021, so about 2 weeks. With that, please take care of yourselves and each other. Be safe and be kind to each other, and we'll keep working together to get to the finish line. We hope to see you next time. Thank you very much.